Welcome, and thank you for joining me for the second edition of our Community Ambassador Notes. I hope everybody is doing well, and where possible, you're adjusting as well as you can to our new work, school, and life realities here in the pandemic. Today, I've got a number of different updates for you on what's going on here at Gifford. I'm going to start with talking about COVID-19. So at Gifford here in the last month, we did have our first inpatient test positive for COVID-19. And this has served as a reminder to all of us, whether Gifford employees or community members, that we must remain vigilant. Even though the situation here in Vermont is much better than it is in most other places in the country, this virus is going to be with us for some time, and it is incumbent upon all of us to be responsible and to make sure that we continue to do a good job in keeping the virus at bay here in Vermont and continue to be an example for the rest of the country. So that means we're going to ask everybody to continue to wear your masks. I know I'm not wearing mine right now, but it's right here. Continue to wash your hands frequently. And continue to practice social distancing when necessary. Gifford, as I hope you know, has a rather robust community testing program here for COVID-19. We have one of the only community-wide testing programs in the state. When we started the program we planned it at the end of April and rolled it out beginning in May. Our goal was that we would do between 40 or 50 tests a day, and that included a combination of people who were symptomatic or potentially had some exposure to people with COVID-19. It also included doing preoperative testing for patients here at Gifford, testing our employees and other groups, in addition to being able to test people in the community who were asymptomatic. We were able to get up to that goal of 40 to 50 over the course of the first couple months, and then when we hit August, we saw those numbers spike to the point that we were doing upwards of 60 to 70 tests per day, which is a good thing. However, it is something that we're going to have to be managing going forward to ensure that we get back to that goal of 40 to 50 a day. There's a number of reasons for that. First and foremost is our capacity here at Gifford to do that higher number of tests. It did stretch our capacity doing 60 to 70 a day. On a broader spectrum, though, we also are seeing with the labs that process these tests for us, and these are labs outside of Gifford, the labs are experiencing some issues with lack of supplies that they need to process the test. We're also seeing in general an uptick in the number of tests that are being done nationwide, and this is causing overall stress on the testing system. So we have a new process in place where we have a dedicated person who is taking calls and scheduling tests for people, and also doing some triage and prioritization of when people are tested. So if you do call, or you have friends or relatives who are calling, if they are asymptomatic, then it may take a little bit more time for them to schedule their test. But we are continuing the program, and we do continue to expect that we will be here and be a resource doing this type of testing for some time here for our community. I also want to just stress that Gifford is open. We have been successful over the past several months coming out of the slowdown or shutdown here in the state to be able to open up our elective services once again. And starting sometime in the month of July, we actually returned to our pre-pandemic volumes in terms of the services we were providing. We've been able to do that while ensuring the safety of both patients and employees, and we want to continue to be able to do that in the future. So I'm asking you for your help and your support in supporting our policies and our processes to keep everybody safe, and that includes requiring that people coming into Gifford wear masks, requiring that people that come into Gifford go through a screening process, and asking everyone to continue to comply with our policies around visitors And we do continue to have limits to the visitors who can come into our facilities. So please do continue to support us with all of that. Those are key components to our being able to continue to keep our environment here at Gifford safe for everybody who comes to us, whether they're employees or patients or community members. And then finally, I want to remind everyone that this is the start of flu season, and ask everyone to please get your flu shot. It's always important that people get a flu shot, but even more so this year with the pandemic, the coronavirus out there. You don't want to have both the flu and the coronavirus. So please do get your flu shot. Contact your provider to get that as soon as possible. I also want to provide a brief overview on Gifford's financial position, which I'm very happy to say is healthy. Going into the pandemic, which from a time period we define as the period before the end of February, Gifford was having a very good fiscal year. We did have a positive bottom line through February. And then with the slowdown, shutdown, stay home period from the middle of March, really for us through June, we were able to utilize state and federal funding that we received during that period to allow us to break even through that period of time. As I noted earlier, in sometime from July and now forward, we have been at our pre-COVID-19 patient volumes, and we've continued to have good financial results in that period as well. So I sit here now in the middle of September with about 2 weeks left in our fiscal year 2020. Our expectation is that we will have a small operating gain for fiscal year 2020, which, as I think probably a lot of you know, is very good news considering the difficulties we've had in the last couple of years. To be able to turn it around the way we have is excellent, and also to do it in the midst of a global health crisis is even more impressive. So kudos to everybody here at Gifford. Everybody's pitched in, everybody's done a great job, and thank you to our community for continuing to support us and continuing to choose Gifford as your option for healthcare services. We appreciate that, and we will continue to be here to serve you moving forward. I also just want to note that this is our period when we present our fiscal year 2021 budget to the Green Mountain Care Board. We've done that. We did our annual presentation to them in August, and I'm very happy to report that earlier this week the Green Mountain Care Board approved our budget as we presented it, and that budget period goes into effect October 1, so just around the corner. Very good news there, and a lot of very positive comments coming out of the Green Mountain Care Board in regard to Gifford and what's happening here. So again, that is a tribute to everybody who works here and the efforts that they do every day. So very good news. I do want to take a real quick moment to acknowledge our employees here at Gifford. This is right now the end of our Employee Appreciation Week, a time when we do a number of events for staff, socially distanced of course, but including recognizing people for length of service. We've been having luncheons, again socially distanced, for people who've been here over 20 years. And we also celebrated people who've had length of service ranging between 5 and 45 years this week. Our employees do a great job every day, and that has been even more so noticeable over the last 6 months, again, during this health crisis that we've had. Our people have shown up, they've continued to do a great job, they've continued to take care of their community. So I ask you, as you are moving around town, if you encounter Gifford staff, please take a second and say thank you and congratulate them on the work that they do. We've got a great team here at Gifford, and very proud to be a part of that. I also want to mention a large project that we've had going on this year. Earlier on in our fiscal year, at the end of calendar year 2019 and into the beginning of 2020, we began renovation on our new Women's Health Center, which will be located at the south end of the hospital. For those of you who've been here for a while, it's the former birthing center area that we're renovating. We started that project again earlier in the year. And the goal of that project is to both centralize and improve the space for our women's health services, including our OBGYN and midwifery practices, and that will benefit both patients and our staff here at Gifford. So we had to delay that project, cease the construction on that when the pandemic started, but I'm very happy to report that in July we were able to start that back up. And now our planned date for having that finished and be able to open up that new center will be in January of 2021. We also started a campaign, a fundraising campaign to support that project, which we also paused during the pandemic. The goal for that campaign is to raise $400,000, and I'm happy to report that we're about 3/4 of the way there now. We had an extremely generous lead gift once again from Gifford's Auxiliary. They stepped forward again and provided a gift of $200,000 to that campaign. So that group, I can't say enough about the work that they do on behalf of Gifford, the support that they provide, and once again they've come to the forefront to lead the community in supporting Gifford. So thank you to them. We've also had 100% support from Gifford's senior leadership team and also from our board, which allows us, with that 100% participation, to then go out to foundations, which is our next step. So we'll go out to foundations to continue raising funds for that project. I also want to note another very large achievement for Gifford. We just recently finished our 15th annual Last Mile Ride. We did a little bit different this year, as we've done pretty much everything a little bit different this year with the pandemic. This year it was a virtual event, and over a 15-day period, people got out, walked, hiked, biked, rode their motorcycles, sent us videos and photos of that, which we were able to post on our website and in our social media feeds. And the community once again came through in historic fashion. This year we raised over $150,000 to support end-of-life care, and that puts us over the $1 million mark for that 15-year period. So a wonderful accomplishment for Gifford, a wonderful accomplishment by and for our community in support of end-of-life care. Thank you again for everything that you've done to support that and to our wider community in supporting that. It's a tremendous program, it's a tremendous service, and it is something that's made possible only by the support of our community. So thank you again to everybody who helped us achieve those very lofty goals. Finally, I want to say thank you to you, our ambassadors, for your continued advocacy and support for Gifford. I want to encourage you, if you have feedback or questions of anything about Gifford, to reach out to me directly, to reach out to our Community Relations Department. We want to hear from you, we want to hear what's on your mind, and we want to continue to find ways to better serve our community with your help. So thank you again, and my best to you and your families. Please take care of yourselves, and we'll get through this time period together, and better times ahead. So thank you again. Take care. Talk to you soon.